Hi everyone, welcome and thank you for joining us for today's ASA web seminar, Understanding and Overcoming the Challenges of an Alzheimer's Diagnosis, which is part of the Empowering Professionals in Aging series presented by Homestead. We'll be getting started shortly. The slides for today's presentation are available under the tab on your screen labeled Resources. And under the tab labeled CE Application here, you'll find information on how to obtain CE credit for this event. You'll have 60 days to complete a continuing education application, and it may take up to 30 days from the date of your application in order for us to process and issue your CE credit. If you are not logged in directly to this webinar, that is if you're watching as part of a group and did not log in using an individual confirmation URL, you will not be eligible for continuing education credit because we have no way to track your online attendance. If you'd like to receive CE credit, please be sure you log in using a confirmation URL you receive after individually registering. If you have questions during the presentation, you can send those at any time using the questions box, and we'll save those for the last 10 to 15 minutes of today's program. And now I'd like to welcome today's presenter. Lakeland Hogan is a gerontologist and caregiver advocate at Homestead. She has worked in the private and public sectors of senior care services and has spoken at national and international conferences on caregiving and aging and serves as a resource to the media. She is a board member of the National Alliance for Caregiving, board chair of the Dreamweaver Foundation, and vice chair of the Alzheimer's Association's Dementia Care Provider Roundtable. Welcome, Lakeland. Thanks for being here today.
Thank you so much, Betsy. Hello, everyone. Thank you so much for joining me today. I loved seeing that video of the On Aging conference at the start of the hour. I'm excited to be attending. I hope all of you are considering it. I know Homestead is a sponsor of the event and we'll have a keynote. I'll give a shameless plug for that. It'll be the first keynote of the day on April 13th, and we'll be talking about creating the world that we all want to grow older in. So I encourage you to sign up if you haven't already, and then also visit our virtual booth. Homestead will have a virtual booth at the conference. So I hope to see you all there. But thank you for joining me today. It's April Fool's Day, but one thing that we know is no joking matter is an Alzheimer's diagnosis. Knowing the warning signs of Alzheimer's disease is really important for early diagnosis and detection. Family members are often the first to notice signs, but they may struggle on how to approach their loved one about scheduling an appointment with their doctor. Once they do broach the subject, they may be met with resistance or denial. And if a diagnosis is received, the individual and their family may be at a loss for what to do next. So as professionals, it's important for us to help aging adults and their families navigate the diagnosis journey by providing them with useful information, support, and resources. And that's what I hope to provide everyone with today on this call. So here are my objectives. We'll go over the warning signs of Alzheimer's disease so that we're all on the same page. We'll also talk about the challenges of early detection and planning. We'll learn about some communication strategies to overcome the challenges of a diagnosis. And then finally, I'll leave you with some resources for both you as a professional and for family caregivers for the diagnosis of Alzheimer's disease and for the care and support. So I am going to review the basics of dementia before we get too far into this presentation. This is likely a review for most of you, but in case you're new to dementia, I do want you to have a baseline understanding. And if you are familiar with dementia, you might pick up a few tips or new approaches on how to explain dementia to a family caregiver that you're working with or an older adult that you're working with. So dementia is a decline in mental ability that's severe enough to interfere with daily life. And to be very clear, this is not a normal part of aging. Dementia is not a normal part of aging. And, you know, some people say, well, isn't a little bit of memory loss normal as we age? And some forgetfulness might be a little normal, you know, forgetting someone's names or forgetting where you left your keys. But often we remember it later. You know, you might wake up in the middle of the night and say, oh, it was Susie, that was her name. Or as you retrace your steps, okay, I came in from the garage and I put the groceries on the counter, and so, oh, I must have left the keys on the kitchen table. Usually we can get back to remembering, but what's not normal is forgetting recently learned information, forgetting important dates or events, asking the same questions over and over, and increasingly needing to rely on memory aids like little reminder notes or sticky notes all over the household to remind you of things. And usually another sign is when family members are having to step up and do things for the individual that they were once able to do on their own. So these are some of the early signs. We'll go into these in more detail in a little bit. Sometimes people get confused by the word dementia. I like to explain it as an umbrella term. So you'll see that umbrella graphic on the screen. It's an overarching term to describe the decline in mental ability. And there are different types of dementia that fall under that umbrella term. So vascular dementia is one type, Lewy body, Alzheimer's is the most common type, and frontal temporal. And then people can have a mix of several types of dementia. But again, Alzheimer's is the most common type of dementia, and that's why it's most often talked about over the other types of dementia. But again, families can easily get confused. They might say, well, my loved one was diagnosed with dementia, but not Alzheimer's, or my loved one was diagnosed with Alzheimer's, not dementia. So you might have to do some education when working with families. But if we look at Alzheimer's disease in more detail, about 60 to 80% of cases of dementia are diagnosed as Alzheimer's. We know the greatest risk factor for Alzheimer's is age, but it is, again, not a normal part of aging. It's not a common, or it is common among older adults, but it's not a normal part of aging. And people can also get it younger, before they turn age 65, and we call that younger onset, or sometimes people refer to it as early onset. And about 5% of people with Alzheimer's disease fall into that category of younger onset. And Alzheimer's develops due to microscopic changes in the brain over time. And research is finding that these changes often start long before the first signs of memory loss. So in our brain, about 20 years prior to us having any symptoms at all, some of these changes are taking place. And you can see by these pictures on the screen how Alzheimer's disease can impact the brain. And there are two abnormal structures called plaques and tangles that can develop in the brain that damage and kill nerve cells in the brain. So you can see that on the photo in the right. The smaller photo is a healthy cell, and then the larger photo shows those kind of plaques and tangles that are developing. And upon autopsy, the brain does show that people with Alzheimer's disease most often have those plaques and tangles. And we all kind of have them as we age, but those with Alzheimer's disease have even more. And so that's really the hallmark sign that someone has Alzheimer's disease. And it can be helpful to remind family caregivers that Alzheimer's is damaging the brain, which is impacting the individual's behaviors and functioning. So mom or dad, aunt or uncle, brother or sister, they're not being aggressive or acting out of character on purpose. The brain is actually failing, it's deteriorating. So the picture on the left-hand side, you see a healthy brain, and on the right-hand side, you see an Alzheimer's brain. And so you can see that the Alzheimer's brain has more atrophy of the cerebral cortex and the hippocampus, and then you can see those enlarged ventricles. So the makeup of the brain is literally changing and causing dementia-related behaviors or symptoms. So again, sometimes families get really offended by their loved one's actions if they have Alzheimer's disease, but we need to remember it's the brain that is failing. The individual is not doing or saying these things on purpose. And we know that there are generally 3 stages to describe Alzheimer's. Some people say there's 5. I think 3 is just easier to remember. So the first stage is the person is still able to function independently for the most part. They might need extra reminders or verbal or nonverbal cues for doing certain activities. I've had the fortune of talking to people living through the dementia process just to get an insight into what it's like. And a lot of people say in the early stage, people say to them, well, you don't look like you have dementia, or you don't act like you have dementia. So in the early stage, for those that are not overly familiar with the individual, they might see them as functioning normally. However, often the family, people that are really close to the individual, and the individual themselves are starting to notice changes. But again, it might not be as noticeable to a friend or an acquaintance. And then in the middle stage is when you start to notice more of those changes in behavior. The individual needs more assistance in their daily routine. And in this stage, you'll also see more issues and challenges with communication. The person might have trouble following a conversation. It might take them longer to process and respond. I always encourage families or care partners, when they're talking with an individual that's maybe in the middle stage, give them a few seconds after you ask them a question or after you finish a statement for them to process the information, think about a response, and then speak their response. So if you were to ask them, how are you feeling today? Pause for 5 to 8 seconds. It might feel like an eternity to you, but again, that person just might need a little extra time to communicate with you. And so giving them that extra space and time can help them continue to engage in conversation. And then also in this middle stage, you might see the individual start to lose their ability to recall names of people and recall items. And that, again, the loss of the ability to recall names, that can be really hard for those loved ones that are close to that individual. But again, it's the brain that is failing and causing these things. And then in the late stage, the person will experience more decline in their physical health. They'll likely lose the ability to walk and eventually become bedridden. They'll likely have difficulty eating and swallowing. Oftentimes, individuals will choke on what they're eating or swallowing, and that can cause complications like pneumonia. And in this last stage, this late stage, the person's ability to communicate is often very limited, and they may no longer be able to verbally express themselves. However, it's important to remember that the individual can still use their other senses, their smell, their taste, oftentimes their eyesight. So it's important not to withdraw from the individual, but to still engage them through all of these stages. And I've read some really interesting findings lately from a survey on COVID-19 that was distributed by Us Against Alzheimer's. And they surveyed caregivers and individuals living with dementia, and they found that 2/3 of caregivers in the survey said that they observed a decline in their loved one's memory and behavior since the COVID-related restrictions and closures and isolation. So you may, in the individuals that you work with, have seen more of a rapid decline throughout this last year because people maybe weren't able to attend adult day programs where they were engaged and stimulated. Perhaps the isolation really contributed to the decline that they're experiencing. So that is something to be mindful of. And so it really is important to know the early signs of Alzheimer's so that we can encourage individuals to seek out an appointment with their healthcare provider to get a diagnosis. So it's really important not to ignore these 10 signs. And these come to us from the Alzheimer's Association. So again, typical age-related changes, somebody might be forgetting a name or where they put the keys, but then remembering them later. But a sign of Alzheimer's disease is memory loss that disrupts daily life. And so when it's disrupting daily life, that's when it's cause for concern. So if you're seeing a lot of sticky notes throughout the house, on the mirror, the bathrooms, the kitchen cabinets, the individual is relying on their smartphone more and more, that might be a sign that there is something going on that needs evaluation by a healthcare provider. Also, challenges in planning or problem solving. One gentleman with younger onset said he noticed changes at work as a first sign. He couldn't keep up with meetings. He couldn't make the numbers add up on spreadsheets. So it really was interrupting his ability to do his work. He was having problems planning and problem solving. Another sign would be difficulties completing familiar tasks. For example, if an individual made the same dish their favorite dish that they brought to every holiday gathering year over year. They could almost make it from memory. Well, if you start to notice, they can't recall the ingredients or they can't follow a recipe anymore, their food's starting to taste a little off, that could be a sign they're having difficulty completing tasks that were once familiar. And then confusion with time or place. This is another early sign. If you've seen the movie Still Alice, she's a woman that is noticing the signs of early onset Alzheimer's. She goes for a run, and it's the same running kind of path through her community that she's done day over day, year over year, and all of a sudden she finds herself in a location where she doesn't recognize, and she's lost. She's legitimately lost. So if you find an individual that you know or love that's having some confusion with time and place, maybe they're getting lost on their drive home from church or from the grocery store, those can be early warning signs. And then maybe you'll find that they have trouble understanding visual images and spatial relations. If you start to notice they're having difficulty with balance or difficulty with reading, those might be early signs. We have some more here on this next slide. You might also see problems with words, either speaking or writing them. You might find the individual searching for a certain word or substituting them for another word that they might not use as often, or you might find them describing what they're trying to say. That might be kind of a red flag, but we need to have this individual make an appointment with their healthcare provider to get further evaluation. Misplacing things and losing the ability to retrace their steps. Again, losing the car keys, maybe they're in the freezer, an odd place to keep your car keys, but the individual is not able to trace their steps back to remember, oh, I must have had them in my hand when I put something into the freezer. Again, if they're not able to retrace their steps, that might be a sign that there's something else going on. Decreased or poor judgment. Often this is seen first in the person's financials. There was actually a really interesting report. I should have written down the exact source for this, but they looked at patterns of financial decisions over a course of, I want to say it was 5 to 10 years. And they were able to track patterns of poor judgment or unusual behaviors of individuals that eventually were diagnosed with some type of dementia. So financials is one area where people should have a heightened awareness. Also withdrawal from work or social activities. They might stop going to a book club or a Bible study or coffee with the guys. And it might be because they themselves are noticing changes in their cognition and they don't want other people to know. They're embarrassed. So they might start to withdraw. And then you might also see their changes in mood or personality. I recently listened to a podcast and the husband was having dramatic mood swings. And it led the couple to end up separating. There was so much tension in the marriage because the husband was having these mood swings. But eventually, he was diagnosed with dementia. And the wife ended up, they moved back in together. And it really was that the dementia, the type of dementia that he had, was causing these mood swings and these personality changes. So when we look at these 10 signs, a one-off situation might not be necessarily a cause for concern, but it's when you start to see, several of these signs and you start to see a little bit of a pattern occurring that we really need to encourage that individual to visit with their healthcare provider about these changes. Because, and you may have started to notice trends in this, that over the years, there has been an importance placed on early detection and diagnosis so that families can plan. And really, an early diagnosis is so important because it can rule out other conditions. The individual might not have cognitive issues. It could be a UTI, a vitamin deficiency, a side effect of a new medication. So it's important to have the person go through an evaluation in case it's something that is treatable. And then getting an early diagnosis also allows for families to plan in the areas of legal, financial, and care decisions. I've heard that, again, families have almost been relieved by a diagnosis because they were just so concerned about their loved one. They didn't know why they were experiencing these changes, and now they knew. They had an answer, and so they could start to plan for the person's future and really get that input from the individual, because early planning can ensure the voice of the person with dementia will be heard and that their wishes will be made known before they're no longer able to contribute because of their cognitive impairment. And when a person is able to make their wishes known to their care team and everyone involved in the care, it can help to reduce feelings later on of guilt and the ambiguity and sadness, because the families already had these conversations. And so when the time comes that family needs or loved ones need to make decisions, they already know what their loved one wants. And then also in the detection and diagnosis process, usually a specialist is engaged. And so these specialists really, they study the disease and they can recommend treatments. While there's no cure for dementia now, there are some medications that can help to reduce the symptoms. And it can also inform the family and the individual about clinical trials. So often families are intimidated by the thought of a clinical trial, but really trials are what are going to help increase the speed of receiving treatment and also help the field come closer to a cure. So a lot of times individuals living with dementia, they partake in clinical trials because they want to be part of the cure one day when it's found. They want to do this for the next generation. And then there are some economic benefits to planning ahead. There has been found to be a cost saving. So early diagnosis can help save the cost of medical care and long-term care because families are able to plan ahead. You know, of those Americans today living with dementia, if all of those were diagnosed earlier, studies have been shown that it could have resulted in trillions of dollars of savings in healthcare and in long-term care. So again, if we're able to have these individuals diagnosed earlier, we can make sure that their plan of care is put in place and that they have the best medical treatment so that down the road there's not a crisis that occurs and then the family is unprepared and the cost is more than anyone expected. But while you know, getting a diagnosis and early detection is the end goal, sometimes families are met with challenges. We know that's the case. I've heard time and time again from family caregivers that they really are challenged by convincing their loved one to get a diagnosis. And so I wanted to kind of present some of these challenges from the various stakeholders that could be involved in the situation. So from the individual's perspective, the one experiencing cognitive issues, they might have a lack of awareness that they are having memory problems. This could be part of the brain that is damaged by dementia. That part of the brain could be, you know, their reasoning and their judgment area of the brain. And so they might not be recognizing that they are having cognitive issues. They might not be able to understand that these issues are a problem. And it might be challenging to convince the individual in those cases to seek out a diagnosis. There's also the fear of the unknown. Many people have an extreme fear of being diagnosed with dementia. I think in a survey once, it was the most feared disease in America. And so you can imagine the type of fear that would cause, the uncertainty, the ambiguity. It would be a lot to process. I mean, can you imagine what it would be like being told that you will progressively decline in your ability to think and reason, your ability to remember the people around you? What if you were told that you would lose control of every part of your life? That would be very scary to come to terms with that reality. So it could be that fear of diagnosis that's preventing people from telling their healthcare provider. And because of all of these things, they might just be in denial that there is an issue. They might be in denial of their diagnosis, and we're going to talk more about that a little later on. And then from the provider perspective, you know, if an individual goes to seek an evaluation, a challenge might be that a provider or the healthcare system, they aren't maybe forthcoming with the diagnosis, or they have some hesitancy to diagnose. And really, since there's limited treatment options and there's no cure, unfortunately, some healthcare providers are hesitant to diagnose because doctors are trained to treat people and to cure their diseases, and in this case, the decline is inevitable. So sometimes doctors have a fear themselves of diagnosing a patient with dementia because they just feel like there's nothing they can do for them. However, this is getting better. Advocacy groups like the Alzheimer's Association and Us Against Alzheimer's, they are working to educate doctors on resources. But still, healthcare providers might be hesitant to diagnose because of things like the anticipated emotional distress of the patient, or they might just not know what kind of community resources and supports exist. So if they do diagnose, they're like, well, what can I provide them? And there are community resources, and again, those advocacy groups are educating providers so that they can provide the individual with some of those resources and support. And then in some communities, there might just be a lack of specialty, people in specialties like neurology or geriatricians are in short supply in our nation. We know that, especially in rural communities. So that might be kind of a hurdle and a challenge for getting a diagnosis. And then there's also stigma still attached to dementia. And this might prevent an individual from pursuing a diagnosis or for families, could prevent families or loved ones from approaching the topic. Some cultures still think that an individual with dementia is quote unquote going crazy or becoming senile, and they just think that that's a normal part of aging. And in some indigenous cultures, they think that the individual is possessed by a demon or something of that sort, or a bad spirit. And so there might be those cultural challenges that exist. But again, this is not a normal part of aging, and it does need medical attention. And then finally, a family might just be reluctant to encourage a diagnosis. And so I wanted to talk a little bit more about that. Some results from a recent survey that the Alzheimer's Association did. They surveyed 1,000 people, and of that, 30% said that they would not talk to a relative about troubling signs of dementia despite their worries. So 30% say, I'm seeing changes, but I'm hesitant to bring up this topic. And the majority of people, 76%, said they would be concerned about offending a family member by bringing up the topic, and 69% said they'd be concerned about ruining their relationship with that person. And I can see where families are coming from. You don't want to, create a rift. You don't want to have that person distrust you or accuse you of, false accusations of memory loss and whatnot. So that would be really challenging. And then 38% said they would wait to talk with their loved one until symptoms worsened. And for me, that's concerning because here we're talking about early detection and diagnosis and the benefits of that. So if family members wait till the symptoms get worse, then it's really a disservice to everyone involved. And I talk with family members a lot about, as they look back, hindsight is 20/20. Their loved one gets diagnosed with dementia, and as they start to learn more about the disease and about the warning signs, they say, you know what, about 5 years ago, I started noticing some changes. Man, I wish I would have said something sooner. So hopefully, with more education and awareness, these types of conversations will maybe be easier to have, or people will just have more knowledge. And so I wanted to provide some tips on, how to have the conversation. But before having the conversation, it's really important to collect detailed information. Educate yourselves on the symptoms of dementia, make a list of the signs and symptoms that you've noticed in the individual, and make special note if you've seen any changes in those signs and symptoms over the past couple of years. List out, when they began, the patterns of those symptoms that are occurring, the frequency, because if you go in for a diagnosis, the healthcare provider is going to ask a lot of those questions. And it can also help to show your loved one that, this is something you've noticed over time. It can also help you collect your thoughts before you have the conversation. But it's really important not to delay. I talked about, the benefits of early diagnosis and detection, so it's really not a conversation to put off very long. And also plan out what you're going to say. It may not be the most effective to speak up in the moment when you witness a memory or behavior change in the individual. You don't want to say like, you've been getting very forgetful lately, or you're not acting like yourself, what's wrong? You don't want to sound accusatory. While it might be said often with the best intentions, it might cause the individual to get defensive, upset, or withdraw from the conversation. So it's important to take some time to develop a plan on how you can have a respectful and productive conversation. And Rush University, they came up with some great questions for loved ones to consider before they approach the individual with cognitive impairment or changes. And they want everyone to consider these questions. So, has the individual noticed the symptoms themselves? Do they think their memory or behavioral issues are just a normal part of aging? They might have that misconception that much of society has, but it is a normal part of aging. What could be stopping them from seeing a doctor? Maybe it's that fear I talked about earlier. Maybe it's a logistical challenge. Maybe they don't have transportation. Maybe it's a financial issue. Maybe they think there won't be any point in seeking a diagnosis because there's no cure. So maybe they have the no cure, why bother kind of mentality. You might also want to consider, what approach has worked in the past for that individual when you've had to persuade them of something or share uncomfortable information. What approach have you taken in the past that maybe has worked and that has not worked? So that might help you tailor your approach. Also, are you the best person for the conversation, or who is? Maybe it's best to have, a one-on-one discussion. Maybe it's best to bring in a couple individuals for kind of a little group meeting. And maybe it's not you. I know in my family, our youngest sister is the best at approaching our parents at hard topics. I'm not a confrontational type person, something I'm working on healthy confrontation, but, so just consider who within the close, tight-knit circle would be best to have this conversation. Does the individual prefer to have a lot of information all at once, or do they like information in little bite-sized nuggets? It might be that you bring up the conversation, and then you have to give the person time to process the information, and maybe you reapproach the conversation at a later date or pick up where you left off. And maybe it would be helpful if you do convince them to go to the doctor to be evaluated, to offer to go with them, or offer up, to help them determine who would be best to accompany them to a doctor's visit. Also pick a comfortable place and time to talk. You want to avoid maybe a public space. Instead, pick something familiar and quiet where you won't be interrupted, and make sure to address the conversation at a time of day where there's enough time, where conversation won't be rushed. And it might be helpful to approach this conversation close to their upcoming doctor's visit so that it's a natural transition. Well, you're visiting the doctor next week. I think maybe we should raise some concerns. How do you feel about that? Again, make sure that the place that you're going to have the conversation, the timing, has some thought to it. And then explain your concerns. Explain the reasons why you want to talk to the individual. Express the care that you have for them, the concern that you have, the patterns you've noticed. Give specific examples, if you can, of incidences or behaviors that could further explain your concern, but do it in a non-judgmental way. You don't want the individual, again, to feel like they're being accused or feel that it's their fault or that you're blaming them, because for cognitive impairment, it is the brain that is failing. The brain is being impacted by the disease, so it isn't their fault. So you don't want them to feel like that. So maybe instead of saying, well, I've noticed you haven't paid your bills lately, that might be a little accusatory, might be a little harsh. You could approach it from a more soft perspective to say, I've noticed that you seem to be having difficulty with your finances. How do you feel about the situation? Do you feel like you're able to pay the bills on time? That could be one, more of a softer approach. And encourage dialogue. let the individual have a say in the conversation. It is their life. It is their issues and challenges that they're living with. So make sure that you approach this not from a, here's what we're going to do perspective, but from more of a kind of a team perspective. We want to help and support you through this. So talk openly and honestly. Don't be afraid to let the individual see that, this is hard for you to bring this up in conversation. It must be hard for them. And just be a good listener. Oftentimes we're so quick to speak and we're less quick to listen. So just listen. Let the individual share their thoughts without interruption. And try not to be dismissive even if you disagree. And then ask the individual for feedback. Have they noticed that something is off? What are their concerns? This is and remember, this is, again, the beginning of a conversation. This conversation might have to take place over months or weeks. And so don't go in with the mindset of we're going to accomplish everything today. It's probably going to take some time. So some additional tips here for having the conversation. Sometimes it might be helpful to have a third party approach the subject, such as a healthcare provider, a social worker, or maybe a different family member. And then also create a positive plan of action together. You really want the end result of the conversation to be an agreed upon next step. And maybe it's scheduling an evaluation with a primary care doctor or a geriatrician. If the individual has anxiety or expresses doubts about visiting the doctor, try to emphasize that this process is going to help them, not harm them. It could be something treatable, so we want to make sure we're ruling those things out. It might be that a medication needs to be adjusted. So again, positive kind of plan of action and outcome. And don't get discouraged if the process takes time. You might find the individual saying that, I'm too busy or I don't want to talk about this. And so you might just have to approach it differently. You might have to seek out professional help. If the individual still won't have a conversation, you might need to reach out to their primary care doctor and express your concerns and see if they have any recommendations on how you can approach the topic. But again, you want to keep in mind that dealing with memory loss of any kind can be extremely stressful for the person that is experiencing it and the person that's caring for them. So it's important to try to avoid heightened emotions. You might feel yourself getting angry, frustrated, upset. And in those moments, try to take time away. Step away, compose yourself, do some deep breathing before resuming the conversation. And sometimes anger can be especially distressing for someone with memory loss. And the last thing we want to do is, again, to think that the individual is being blamed. And the last thing we want is for that individual to resent the person that brought up the topic. So if we are able to have the conversation and we're able to get our loved one to the healthcare provider, it's important to kind of understand the process of diagnosis. So when getting a diagnosis or when going to that healthcare appointment, it's really important to be prepared. Most people, they don't realize that cognitive screening is part of the Medicare annual wellness visit. So you can request that cognitive screening be done if your doctor already doesn't do that. That gives families and the individual a nice baseline of cognition. So can track changes over time. So that I think is good for all of us to be, asking our doctors about our brain health. A checkup from the neck up is a kind of a kitschy term or phrase that's used for this, but it is important to be, even before we notice signs of memory loss, to be talking to our doctors about cognitive health. But if your loved one is experiencing symptoms, you'll want to keep a journal of those symptoms or write them down, especially the patterns that you're seeing, because when you go in for this appointment, you're likely going to be asked, what kind of symptoms have you noticed? When did they begin? How often have they happened? And have they gotten worse? So it's important to be prepared for those types of questions. And it's also possible that if the general practitioner, if that's where you start, you go see your general practitioner, they will likely refer you to a specialist where you'll go for further evaluation. So the diagnostic process is likely to include your medical history, a physical exam, a diagnostic test, Again, a lot of times that physical exam is to rule out other causes. Again, it could be something other than dementia. You might also find that the individual goes through a neurological exam, the mental status testing, and even brain imaging. And the diagnosis, it's come a ways in terms of the science. And so there are some more sophisticated diagnostic technology that could be used depending on the situation. But again, even if there is a diagnosis, you might find that the individual is in denial about the diagnosis. And so I wanted to go over some tips to share with families, with loved ones, if the individual has some denial. So when talking with the individual about their diagnosis or denials, again, important to remain calm. As mentioned earlier, it can be easy to get worked up and to become angry and really frustrated that the person is not understanding that they just got a diagnosis. You need to give the person some time and space to think about the diagnosis. It can be really overwhelming. It may be that the individual needs to take time to process what the diagnosis means. So again, give them a little space and try to approach the topic later, or ask them when would be a good time in the future to talk about this recent diagnosis. Again, keep a diary of events, examples of issues, dates, times, locations of what has happened. So this record can support the person in their approach to the individual with diagnosis, if it feels appropriate for the conversation, to show them again that you're caring about them, you're concerned for them, and then ask if you can accompany them to their next doctor's appointment, and let them know that you want to talk to the doctor together about what is normal aging versus abnormal aging, because the individual might think that their memory loss is a part of normal aging. So perhaps if they're able to learn from their healthcare provider, what is normal aging compared to what they're experiencing, it might help become more clear to them. It may also be helpful to join local support groups with others to talk about their diagnosis. Sometimes it may be easier to talk to a stranger or to another person who has had a diagnosis as opposed to talking to their loved ones about it. So that can be helpful. And you can look into options for therapy, professional counseling. Sometimes art therapy can help an individual express themselves, express their concerns, their feelings, and their emotions. Again, it might be easier to talk to a stranger than talking with their loved ones about their diagnosis. And also just talking further with the healthcare provider, say, I know that this diagnosis is a lot to take in. Let's schedule a follow-up call and talk further with the provider about what that really means and what the options are potentially for treatments or clinical trials. And then if this doesn't work, you might consider speaking to the person's doctor yourself. It's best to get the person's consent before doing so, or at least tell the individual, I'm going to speak to your doctor. And then you can always express your concerns to their doctor. They might not be able to reciprocate information because of HIPAA, but you can express your concerns to the person's healthcare provider. And some people may be in denial because they fear the stigma of a diagnosis means that life is over. But I think it's really important that we continue to share the message, pardon me, that there is life after a diagnosis of dementia. Again, often it can be so scary to have that diagnosis, but there are so many individuals that go on to live a very full life after a diagnosis. And life might have to look a little different, but people have continued to find meaning and find new ways to express themselves. So again, I've gotten to meet people living with dementia over the years and to see how they have continued to live life after a diagnosis. And a lot of times they say, your life can still have that meaning, that purpose. You can create kind of your bucket list of things you want to still accomplish and find ways to do that. Find support, engage with others going through similar situations, whether it's in person or online, engaging in clinical trials, making a difference by joining in the science and the research behind future treatments for Alzheimer's. That gives people a lot of meaning and purpose. becoming an Alzheimer's advocate. Organizations like the Alzheimer's Association and Us Against Alzheimer's, they have opportunities for ongoing advocacy. You can go speak with your senators and your local and even national lawmakers on increased funding for dementia research, those types of things. You can make those goals and plans for the future. You can still set goals. Maybe it's to travel to your hometown or to take that fishing trip you've been wanting to take. You can still make things to look forward to in the future. The person can also explore new hobbies. Many people after a diagnosis discover that art is a great way to express themselves, or they find that other hobbies are a good outlet for emotions. And hobbies can also help to keep the brain active. And then to find strategies to help maintain independence. I did a live chat with several, or I've done live chats with several people living with dementia, and Dr. Cynthia Hummel, who's pictured there on the slide, she's one of those individuals, and I was really interested to learn all of the strategies that she has to help maintain her independence. She still lives independently and has had a diagnosis of Alzheimer's for several years. She has a system set up of reminders through sticky notes and her phone. She puts sticky notes on her bathroom mirror and on her car dashboard, and she has this bench in her home that she goes to every morning, and it kind of helps her start her day. So the day before, she's laying things out on this bench to help prepare her for the next day's activity. And so when she wakes up in the morning, she goes to that bench, and a lot of the things that she needs for that day is right there. So individuals can find ways to still be independent. And it's important to still focus on what you can do, your skills and abilities, and not really focus on what's been lost. If you're focused on what they can still do, it can bring confidence and, again, that meaning and purpose. And Dr. Cynthia, she has created these masks that you can see here on the picture. This is kind of one of her outlets that she is able to express the frustrations and some of what she's experiencing because of her Alzheimer's through art. So each of these masks have a different title and description, and they all help to illustrate what she's going through. And so I really enjoyed my conversation with her. If you want to listen to it, I've included the link. It's really small on the slide, but you can listen to our chat and how she continues to live life after diagnosis. And there is a group called Dementia Action Alliance, or Dementia Alliance International, DAI. And I love this quote: "Everyone has the possibility of having value every day of their lives, no matter what stage of the disease they are in." So this group is a great advocacy group. They're all individuals living with dementia. So again, another great resource for those that do have a diagnosis, to join others and to learn what they're doing and how they're continuing to live life after diagnosis. And for many, that can be really comforting. So before I open it up for questions, I did want to share some resources. At Home Instead, we have a book called Confidence to Care, authored by Molly Carpenter, and it's a resource for family caregivers. So you can purchase the book or visit the website for more information. We also have a free Alzheimer's app called the Daily Companion app, and you can find it in your local app store, or your Apple or Android app store, pardon me. And then also here are some resources. helpforalzheimersfamilies.com, that's a website that Home Instead has. I do a monthly live chat on caregiving and dementia-related topics, and so you can see all of our past chats on there, and you can join our upcoming chats this month, actually. It's April already, can you believe it? This month I'll be talking with several people from Us Against Alzheimer's about more of their COVID-related research on how COVID has impacted dementia caregiving. So I would love for you to join us. And also there is a dementia respite care grant application that you can find on that website. If you are a care partner, you're wanting some respite from the care that you're providing. It's a great resource for professionals too to pass along. We also have a really active Facebook community. I know there's lots of Facebook communities out there on Alzheimer's, but ours is Remember for Alzheimer's Families. There's also caregiverstress.com for general caregiving resources. You can see the full list of CE webinars like this one. This is part of our series. You can find the information there. Home Instead, of course, we support individuals living with dementia and their families and their loved ones and care partners. So if in-home care would be something that you want more information on, visit homeinstead.com. And then a book that can be really helpful is The Best Friends Approach by Virginia Bell and David Troxel. It can be a great book for maybe a family member, care partner with a loved one who's newly diagnosed with dementia. Of course, the Alzheimer's Association has a great website, a 24/7 helpline. And then Us Against Alzheimer's, they have a great platform where family, caregivers, and individuals living with dementia can provide insight that can contribute to research. It's called the A-List, and so you can go to their website to learn more. And then for those that aren't living with Alzheimer's as the type of dementia, frontotemporal dementia and Lewy body dementia are two of the others that fall under that umbrella. They have different challenges at times. And so the Association for Frontotemporal Degeneration is a great website. And then also the Lewy Body Dementia Association is another great resource. And then there's that website for the Dementia Alliance International, DAI, for those living with dementia. I did also, just today, I sat in on a webinar hosted by Us Against Alzheimer's. They just yesterday released a tool called the Brain Guide, and I wasn't able to get it on the slide, but that website helps people through the diagnosis process. And the website is mybrainguide.org. And on there, you can, there's a little quiz where you can evaluate, is what I'm seeing in my loved one normal or abnormal aging? And there's so many great resources. I have yet to dive in and discover them all yet, but I was just so excited by this website. Again, it's mybrainguide.org. And for those that don't have internet access, this website has a 800 number that you can call, and it will verbally walk you through that assessment of have you noticed changes in your loved one's cognition? Have you noticed changes in their behaviors? And so I love that there's we live in a tech-savvy world for most of us, but some people don't have access to a computer. They just have a landline. And so the phone number for that is 855-BRAIN-411. So 855-BRAIN-411. And that, again, is the phone number for the Brain Guide. So I hope that today you have learned the importance of a diagnosis. You've learned how to overcome some of the challenges that a diagnosis can bring to the individual, to the family, the loved ones, the care partners, and most importantly, how we can encourage early detection and diagnosis, because the earlier we can detect and diagnose, the more time it allows for planning and for the individual with memory issues to participate in the planning. So with that, I will now open it up for questions. So Betsy, I'll turn it over to you.
Great, thanks so much, Lakeland. We have a few questions that have come in. The first one was, how long on average do people remain in early and middle stages?
That is a really great question. I don't know if you've heard the kind of the phrase, if you've met one person with Alzheimer's, you've met one person, or you've met one person with dementia, you've met one person, because everyone's experience is so unique. I mean, I've met family care partners that have their loved one had a diagnosis for 2 years. I know people who have been caring 20 plus years for a loved one with cognitive impairment. So it really depends. I think that just from my experience, people often are kind of in that middle stage for what it seems like longer, maybe because people are getting diagnosed later on. So maybe they went through that kind of early stage, undiagnosed, undetected, and so they get a diagnosis, and so it seems like that middle stage is longer. But it could be, I think I've seen stats that, on average it's anywhere from 6 to 8 years, anywhere from 4 to 8 years that someone lives with a diagnosis of dementia, but it really is unique to that person. And I think too, if a diagnosis can happen early on, and some of those treatments that exist now, some of the Alzheimer's related drugs that can help with some of the symptoms, if those can be implemented sooner, hopefully that helps the individual live a little more independently, or the caregivers can provide care to them longer when they're able to benefit from those treatments. So I wish I had a succinct answer for you. I appreciate the question, but I'll have to leave you with it depends on the situation.
Great. We've gotten a few questions on kind of how to identify the specific types of dementia and how Alzheimer's might be different.
That is a great question. So frontotemporal dementia, often you'll see poor judgment. So it's impacting that front lobe of the brain that is responsible for our ability to reason and for our ability for judgment. So from what I've heard from family care partners is that they have started to see maybe more mood swings, behaviors or that are really out of character. Maybe they get really agitated or upset out of nowhere, more so than they ever did before. Or maybe the finances, again, that poor judgment. Maybe they're making kind of irrational decisions. They're taking a lot of money out of their investments, or they're buying a giant boat when you live, in a landlocked city, things like that. So that could be some of the early signs for that. Lewy body dementia, often we see that diagnosed hand in hand with Parkinson's disease. And so often an individual has Parkinson's-like symptoms before they develop Lewy body dementia. But again, it's very situational. Not everyone has every single symptom. So I would encourage you, I'll go back a slide here, to visit the Association for Frontotemporal Degeneration and the Lewy Body Dementia Association's websites to really dive deeper into those two. I have not found a great resource for vascular dementia. If anyone has that, please email me. I have been searching for, I'll find an article here or there, but vascular dementia, we see sometimes that happening maybe after a stroke, for those maybe who have had a lifelong issue with substance abuse that's impacting the blood vessels in the brain. So the symptoms sometimes are similar to Alzheimer's disease. But again, I could probably give an entire presentation on the differences between Alzheimer's and the other types of dementias. But I really would encourage you to visit those sites. And again, if anyone has a great resource for vascular dementia, please email me. I'll put my email address right back up there because that is one area that I definitely am hungry to learn more about. And I want to be able to provide families with more resources on.
Great. I think we have time for one more question. We've gotten a few on communication. So what do you do when a family member gets upset if you're saying something about your concerns? And also, if you have any advice about talking to a doctor who's afraid to make a diagnosis of dementia.
Yeah, that's really challenging. I would say, if you're approaching an individual about the subject of changes that you're noticing, you might just want to give them a little space. Present to them your concern, outline some areas where you've seen changes, and they might just need a little time to process it. They might be really upset in the moment. And again, you want to make sure that you're approaching the conversation from a way that you're not accusing them of anything, because maybe they are getting defensive because they feel accused. And so it's really tough. I would encourage, well, in both cases, for the other question was, what if the healthcare provider isn't willing to make a diagnosis? You reach out to your local Alzheimer's Association to see if they have recommendations. They have a community resource finder. If you go to communityresourcefinder.org, you can look up specialists in your area. So I would say if your healthcare provider is not willing to give a diagnosis, you have the right to go get a second opinion. And I would encourage you to do so, especially if you know in your gut there is something that's not right and that doctor's not willing to make the diagnosis, I would seek a second opinion. It never hurts to do that. Oftentimes you see in small town communities where maybe that's the case, and you don't want to ruin the relationship with the doctor. And often people see their doctor as an authority figure, but you're the patient and you have the right to seek out another opinion. So I would say also, the Alzheimer's Association would have probably some more tips. And I know that they have a provider toolkit. So maybe it's, seeking out that provider toolkit from the association and giving it to your doctor, because maybe they need the resources to help the patients and families that you work with.
Great, thank you so much. We had a question about the app. That app was called Alzheimer's and Other Dementia's Daily Companion app, and that's going to be on your in your app store. And we've reached the end of our hour, Lakeland. Thank you so much for being here with us today.
Thank you so much, Betsy. Thank you, everyone, and I wish you a wonderful spring. I can't believe we're already at April, and hope that you have a great spring, and hope to interact with you all at the upcoming On Aging conference. We'll see you all then.
If you'd like to claim CEUs for today's web seminar, you'll receive a follow-up email by the end of the business day that will contain a link to the CEU application. That email will also contain a link where you can download today's slides. You'll have 60 days to claim CEUs for this event, and it will take 30 days from the date of your submission in order for us to process and issue your CE credit. Thanks everyone for joining us today. Have a great rest of your day.